Tragic landmark. More than 10,000 Canadians have lost their lives due to COVID-19. 10,000 Canadians, not just a statistic. That's since the first death took place March 8th at the Lynn Valley Long-Term Care Home in North Vancouver. Now, this pandemic has had widespread consequences on the country, on people's lives, on the economy, even on trust right now for authority figures. A new report released today by Canada's top doctor, Dr. Theresa Tam, says structural changes are needed to address social, economic inequities to prevent a similar outcome in the future. But will those changes be enough to slow down the second wave? What will actually make a difference? Joining me now is the Chief Public Health Officer, Dr. Theresa Tam, to discuss all this. First of all, Dr. Tam, always good to have you on the program, and your tireless work is noted by all Canadians. Look, a tragic milestone was passed on Tuesday, 10,000 deaths. Is this worse than you first estimated back in February and March, or are these numbers lower than you estimated?
Well, it's actually really difficult to estimate the trajectory of a pandemic. We only do modeling just to look at scenarios and what could happen. So everything is down to what we actually do in terms of how the pandemic will evolve in Canada. So, of course, 10,000 persons who died of COVID-19 is a very sobering number. And for the most part, these are our elders, our seniors, and particularly those who live in long-term care. And that, in a way, because this virus entered those high-risk environments, is why we have so many deaths in Canada.
That's right. 80% of the deaths were in long-term care homes, some public, some private. Most of the deaths, as you say, were with the elderly. Since then, given all the measures that have been taken, and here we are in the second wave, should we expect that deaths in those kind of facilities should be slowing down after 8 months of work on this, or in the second wave, are you expecting the same numbers again?
Well, again, everything's up to what we do. Now, right now, the second resurgence, a lot of the cases are in the younger adult population. But what we're seeing is that it's beginning to permeate through other age groups, including the elderly. And we are seeing long-term care facility outbreaks in increasing numbers.
Right.
What we have seen is that those outbreaks tend to be smaller than they were before, but it's still a very concerning sign. We need to double up. I know a lot of efforts have gone into improving infection control, supporting workers as well as residents in long-term care. But clearly, some outbreaks are still happening because this virus is a very sneaky virus. It's somewhat invisible and transmits when people are asymptomatic as well. So we got to be extremely vigilant, which is why decelerating transmission in the community is one of the key ways to protect our elderly.
But you know, look, there's a lot of COVID fatigue, and you're seeing it and you're hearing it. People are just saying, I'm sick of it. I don't get it. Most of the deaths were elderly people. And by the way, that doesn't mean they count less. I'm just repeating what many people say, that even though we're in a second wave, their argument is the second wave will not be as bad as the first because younger people are getting it and the mortality rates will be significantly lower. Therefore, we should open up more and we should not have the restrictions. When folks give you that argument, what do you say?
Well, I think that's a really dangerous sort of bit of thinking. I mean, we would want to make sure that we minimize impacts on long-term care and our elderly as much as possible, as do everything in that way. But what we will see in different countries is that even though things may start in the younger population, and that's expected, as society opened up, this is not like in the first wave when people were staying at home. A lot of people are now in our social and community spaces. So, but we cannot completely segregate different age groups, and we're beginning to see this incursion into older age groups and in long-term care as we speak. The other thing to observe is that hospitalizations and deaths are lower, but they are beginning to increase. and they tend to fall behind the increase in cases.
Right.
And so that is something that we absolutely have to take really seriously. Some cities, as you may have heard, are already beginning to scale back their elective surgeries as they see the number of cases increase.
Well, the Canadian Medical Association wants $1.3 billion just to help the backlog of the 6 big procedures like cataract, hip, heart. So there's been a knock-on consequence. But you say in your report released today that people of color are far more likely to contract COVID-19. You in fact said your postal code is as important as your genetic code. And the report says that Arab, Black, Latino, Latin American, Middle Eastern, South Asian, Southeast Asian Canadians account for more than 80% of the cases in cities like Toronto. They're less than half the population. So what is going on there? Why is that happening?
So we have to be extremely careful when we are reporting on statistics like this. So the most important way to look at it is because there are certain populations in our society that is experiencing what I would call inequities, structural disadvantages, making them more sort of at risk of the COVID-19. For example, many of the personal support workers and other health service workers, particularly those in lower paying jobs, tend to be in racialized population. Many are women, maybe single parents trying to hold down more than one job, and they have to go out to work. They can't stay at home like a number of us can. So they are at an increased risk of acquiring infection. We depend on them to support our food production. You've heard about these large outbreaks, for example, in meat packing plants in certain agricultural settings. So it's because they are serving the community to make sure many of us can observe the public health measures as well. So I think it's really important to remember that. And because of long-standing inequities, they are being impacted the most. And when I said about the geographic location, it's actually a really important piece of data that cities like Toronto have. It's showing where the areas of the city with the highest cases, and they do tend to be in more lower income neighborhoods. What that's telling us, we need to put more resources there. We need to make sure they have access to lab testing. We need to make sure there's isolation, voluntary isolation sites if they're in crowded living conditions. So that is what that's telling us.
Right, and that's critical. But some people think, look, we got a problem here because these blanket restrictions, some folks are saying it doesn't apply to me, doesn't apply to my age group, doesn't apply to my postal code, to use the phrase that you just used, my city, my area. Do you think there needs to be, one, a more centralized messaging about things, and two, less blanket restrictions and maybe more targeted, not only restrictions, but targeted funding to deal with some of the inequities?
Well, I think, my bottom line, as I said in my report, is no one is protected until everyone's protected. Because, we live in a society that has mobility. We depend on each other in order to, support the community, have these essential services. So, but let's just say this is a more complex situation we have now in this resurgence that we're seeing in the fall. Because public health is trying to get that balance. How can we, we want kids to go back to school. We want people to go back to workplaces. At the same time as we want to control the community's transmission to keep it at a level of which our health system, our public health system can manage. That is a delicate balance. You're not seeing the sort of blanket approaches that we're seeing during the initial wave. That in and of itself is causing some complications and mixed messages. We as medical officers of health recognize that we actually have the same core public health messages. It's just that at different localities, the pandemic is behaving a bit differently, and you need to listen to local public health. But our core messages have always been the same. I would look at it in this way. We do have a marathon ahead of us, and we need to build in some daily habits, some of which are actually not that difficult to do. So physical distancing, hand washing, hand hygiene, wearing a mask, avoid closed, crowded places where you're going to be face-to-face with people, but if you can't put in those public health measures.
But Dr. Tam, look, in your report you talk about opioid deaths, addiction, suicides. These are all gone up. And people are saying, you know what, the part of these restrictions are almost worse than the disease. And you know that's led a lot of people to say, you know, I just got to open my business, my gym, or I'm going to visit my family at Christmas no matter what the public health says, because you know, the cure is worse than the disease from my point of view, they say. What do you say to people who say that? What do you say to people who say, I don't care what the public health says, I'm going to see my family at Christmas? End of story. What's your message to them?
Well, I think right now, more than ever, it's really important to get those basic core public health measures, and each of us can take it on. I do think that there is quite a number of months ahead of us. We're working hard on vaccines and treatments. But every one of us can do those pieces. Now, I think the key, and public health is trying very hard to, well, how can we return to some of these activities in a safer way? It's not about saying, you know, you should not go to a certain place, you should not go to a certain setting, but how do we make those settings as safe as possible? It's only when that is getting out of hand, when public health can't keep up with, well, the tens of contacts each person has, that makes it really difficult, right, and sort of supports acceleration of the epidemic. So I think, you know, just as much as possible, keep to your core household, keep your other contacts to a minimum, do those things. If everybody does that, then we can keep the transmission low. And I think it is a long journey, but it's a bit like running a marathon when you need a bit of that second wind. Right. And I think we need to motivate each other in those ways. Countries that have done well are where populations have that societal cohesion, that trust, right, in public health. And so we need to just keep going. For now, right, the pandemic, we will get through this, but right now we need to keep going.
All right, I got to leave it there. Thanks so much for joining us on Power Play. Appreciate it.
It's my pleasure.